This is an ideal time where one would develop modules for telehealth and how you could reach patients. This is particularly important in cancer and oncology because patients would benefit having an intervention being at home when they may not be very fit to travel, even in times when there is no COVID. So I think a few pointers. This is not new, but in a low and middle income country like India, which has a huge amount of subscribers for mobile phones, this could be used in to the advantage of the patients. When we plan telehealth, I think it's important that we plan, even if the plan is brief. There is not much time to have an elaborate plan now, but we should have a brief plan and be ready to adapt. Face to face meeting is not possible, but the advantages that, as I mentioned, that in telehealth the people can contact a health provider sitting at home. It also provides anonymity in certain situations that may be preferable when you are talking about emotional health, particularly. Um, Telehealth is not necessarily a phone helpline. You need to make appointments scheduled, and one needs to get ready for medical care if there are reports to be looked at, or any images to be looked at. Sometimes that may require some time because there is a data and broadband and uploads, those sort of technical issues. But it is surprising. I had a colleague in England actually who was doing telehealth consultation with patients, and he said that he was himself surprised at how much you could achieve over telephones and Skype interviews. So telephone based consultations, when one is done, what has shown, the evidence has shown that the telecounselor or the person who is providing the healthcare, if they is verbally active and sort of navigates the patient and sort of guides the interview, it is often appreciated more, and they have to be actively exploring various aspects of the problem that is um, brought over by the patient. In internet-based consultations, mental health, there are a plethora of websites. So there could be, information providing websites. There could be, screening consultations or screening questionnaires which people fill up in vernaculars. There could be online consultation like through WhatsApp or Skype. There could be self-guided treatment programs where the software delivers a CBT or cognitive behavior therapy kind of model. And there is also the role of online support group where multiple cancer patients come together in a chat room or a forum and support each other. So the role is immense, what it could be used for. The Recently, the Ministry of Health and Family Welfare in India has actually brought out a document yesterday about what would be telehealth policies, and it has actually allowed prescriptions through internet. There are certain kinds of drugs which can be prescribed. There are some restrictions on, so doctors need to work on them and provide the patient a solution which is acceptable in a crisis like now. There are some technical issues about data protection, confidentiality, and end to end encryptions. So these are technical issues which can be sorted with the experts looking into it. So I feel that telehealth, particularly for psychological support in oncology, is a important tool right now because patients are often stranded at home and are feeling anxious. They might not be feeling well enough to be, reach a hospital, even if they have the means to. So this is an opportunity which a low and middle income country should develop.